How to know whether your prostate gland is healthy or not? First of all, know what is prostate gland. Actually, it is a small rubbery gland situated deep in the pelvis, between the rectum and the spine or the base of the penis. Actually, this is the organ which is present in every male individual, and this organ can be palpated by doing a parietal examination. What are the functions of prostate gland per se? So basically, it is in the seminal fluid production, the nourishment of the seminal fluid, the prostate gland help in the urethral closure during the ejaculation, and regulation of the male sex hormones. So, what is the actual intention of knowing all these things? Because in prostate gland we see n number of diseases. For example, we see prostatitis, which is actually the inflammation of the prostate gland. We see the benign prostatic hyperplasia, which is the benign enlargement of the prostate, and the prostatic cancer. So these are mainly the three disease entities which we should be aware of. For example, prostatitis, which is actually inflammation of the prostate gland, wherein the condition is a very painful swelling deep in the pelvis, and it is generally seen in young adults. This can be managed by giving antibiotics, and conservative management is good enough to tackle this disease. Now, benign prostatic hyperplasia is a benign condition wherein the prostate gland generally increases in size with the age number. For example, it is generally seen in the elderly population. It is not a cancerous condition, but one has to rule out the malignancy in such cases. Doing a proper physical examination and some tests would diagnose this particular condition. And lastly, we should be aware of the prostatic cancer. We generally see in the elderly group. We have a number of histopathological variants in prostatic malignancy, but most commonly is the prostatic cancer, wherein the score is important to diagnose this particular cancer. So, how do you know the prostate is unhealthy, or what are the symptoms of prostatic disease? Generally, it is dysuria, difficulty in urination, and we generally see urge to urinate even when the bladder is empty. Sometimes you have bleeding while urinating, or sometimes you have pain during urinating, or some dribbling micturition, incomplete sensation of urination. These are general symptoms of prostatic disease. Now, how do you diagnose prostatic disease? Generally, the first thing a doctor would do is to do a digital rectal examination, wherein a doctor passes a finger in the rectum, and thereby palpating the prostate gland to feel the size of the prostate gland, to see the consistency of the prostate gland, to see if there is any kind of tenderness. So that is how clinical examination is done. Then one does an ultrasound of the abdomen, pelvis, and the prostate gland per se, wherein the intention is to look for the prostatic gland size, whether it is causing the post-void urine measurement, and which is causing outlet obstruction. So generally, an ultrasound will tell you all these things, whether there is a median prostatic hyperplasia or not. So generally, ultrasound can be good enough to diagnose the cases of benign prostatic hyperplasia. But in case needed, one when is doubtful about the malignancy per se, in such cases, some extra investigations like MR imaging can be advised. And then, in addition to that, some blood investigations like serum PSA is done. PSA is a prostate-specific antigen, and in this PSA, there is a free PSA, PSA velocity, and all these things can be done so as to diagnose whether it is a prostatic cancer or not. Now, if at all somebody who has a benign prostatic hyperplasia, that's a benign disease, some medications can help to relieve the symptoms, or if required, a surgery can be done, which is called as a transurethral prostatic resection, that is called TURP. If at all somebody is diagnosed with prostatic cancer, one needs to diagnose whether it is a localized disease or whether disease has spread locally, which is called as locally advanced disease, or the disease has gone outside the pelvis into the there is a distant metastasis. Now, if the disease is confined to the prostate gland itself, one can go ahead with the radiation therapy or the radical prostatectomy, or wakeful watch if at all the patient is comorbid and very elderly. If the disease is locally advanced, in such cases, neoadjuvant hormonal therapy can be tried, and later on radiation can be thought of. And if at all, if the disease has spread all over the body, it's a distal metastasis is there, which is called as metastatic prostate cancer. In such cases, we can think about surgical or medical castration. And in addition to that, depending upon the magnitude of the disease or disease burden, one can think about chemotherapy and it will just spread to other organs, palliative radiation, and so forth. So basically, these are the basic outlines to deal with prostatic disease. But one should be aware of the symptomatology to know whether prostate gland is healthy or not. Thank you.